I used to think that the biggest killers in the world were things like heart attack, diabetes, cancer, etc. It turns out, actually, that may not be the case.
Absolutely. If we look at the history of fatality, it used to be many years ago, communicable diseases, accidents, things that just put the brakes on your life altogether. Modernization has got rid of those elements across the globe, but we've replaced them with something else. And all the things you mentioned stem from one root cause, and that's called inflammation.
Okay, so if that's the case, then the whole of the medical system is currently geared around either dealing with, after the event, or preventing heart attacks, diabetes, cancer, etc. But if we found something else, which we'll come on to in a minute, that seems like that might cause a bit of an upheaval in the system.
Absolutely. I mean, the thing is, as we've progressed in medicine, we've learned to diagnose very well. So well that we now have 126,000 diseases in the system. And by the way, 20,000 FDA-approved drugs too. Now, thinking about that, what that's led to is a medical system where you get more and more specialists. And as you get more and more specialists, the doctors distance themselves from the holistic patient. And therefore, what happens is that we as professionals try and manage what we can. If we can't manage it, we refer to a specialist. If they can't manage it, they refer to a super specialist. Each time, the individual gets more specialized in their area of interest. And whether it's chest medicine, cardiology, it doesn't really matter. But they become very specific in what they're trying to do, i.e. mitigate a symptom. So there's more drugs to mitigate a symptom. There's more therapies. There's more diagnostics to diagnose that symptom. But what we have to remember is the root cause of all of this. And as we distance ourselves from the patient, we're also distancing ourselves from the root cause. And with this, we will have a system where we're not quite getting on top of it. We already know that we're not managing chronic disease. Chronic disease is on the up.
Is that right?
Absolutely. And it is the biggest user of our healthcare economy in the UK, but also in the Western world, and now moving on into the developing countries.
And chronic diseases such as?
Chronic diseases such as what you mentioned, diabetes, heart disease, respiratory syndromes, gut disease, joint pains, musculoskeletal disease. All of these disorders are increasing in their prevalence, and we're finding it hard to manage. So much so that the Health and Social Care Act sort of merged healthcare and social care, because at a certain point, all these chronic diseases led to social issues, disability, inability to function in the activities of daily living. So what we've now done is replace the management of these, not with medicine, but with social care. So we have a real problem. And of course, the budgets are not infinite, and people are existing longer. I use the word existing rather than living. And this burden is escalating, and we have not had a solution through this specialized disease model. So we need to do something different.